Thank you so much for coming. I think everybody has seen these slides. I need to advance the slides. And so what we want to do, well, we saw this, here are our sponsors. You saw the purpose. You look at the agenda, and we're very excited to have Linda Shack and two elected officials from, one from Colorado, one from Virginia, to share their experiences and successes. And then we're looking forward to hearing about messaging, making the case for healthier communities. Housekeeping, well, you guys did a great job of doing the poll and text chatting your questions. So we'll just move right on to Linda's presentation, and we will change the presenter so that you have the slides. So there we go. Linda.
Great. Thank you so much, Charlotte. I'm going to back things up just a little bit. As I was saying a little earlier, you all know very well, many of you for your entire political careers have been working on healthy eating and active living and other health-related issues, and some of you are pretty new to this as well. And so for those on the call, we wanted to give a little bit of a sense of best practices before having two very special guests talk about their own experiences. I've already gone through a couple slides that share, sorry, I'm backing up a little bit, what does health have to do with it? I shared this slide with you, an example of a franchisee owner trying to do good and have a fundraiser for diabetes, but what does health have to do with it? What kind of mixed messages do those send to people? Children in our schools being inundated by unhealthy products, and even often when they leave schools, the products that they're exposed to really aren't conducive to healthy eating. And often in more rural areas, we know that things like walking and biking and taking public transit are really difficult and challenging, and that often the infrastructure for transportation that exists is really built around cars and not around these alternative forms of transportation. And this was also an image someone shared with us, and and at first glance we might not even know what health has to do with it, but actually when we really think about it, just when people don't have access to the types of products and services they need in their community, when this is sort of what people see when they walk down the street, it really is both, something around physical and social and emotional health that people experience. And so, the question really becomes, is it just about individual choice and individual behavior when people are living in communities where they don't have access to these types of resources and infrastructure? And, I really feel like the Institute of Medicine said it best when they said that it is unreasonable to expect that people will change their behavior easily when there are so many forces in the social, cultural, and physical environment that conspire against such change. And what's really, to me, really hits home about this quote is this is a body of doctors, people who are used to giving individual treatment one person at a time, who have looked at the research and said it's not just about individuals, it's really about the environment. So at Prevention Institute, we really say that prevention is the prescription, and really quality prevention is the prescription. And when we say that, we mean prevention is aimed at addressing the community environment, it's comprehensive, and it changes norms. And for those of you who are on the call who are elected officials, who are the staff of elected officials, and I know we even have people on the call who are other folks in the community, advocates, public health folks, people who really are supporting these types of efforts. This is really, what a lot of you are doing, and it's really inspiring to see. Just a couple examples I wanted to share with you before, really allowing you all to hear from our guests. But one example that we've seen recently around safe routes in a rural community is in the Sault Ste. Marie tribe of Chippewa Indians, which covers 7 rural counties in Michigan's eastern Upper Peninsula. And they really were having challenges around walkability in their community. So after conducting community walk audits, the tribal transportation planners, along with the city leaders, because they were based in counties as well, worked together to invest in sidewalk improvements to connect housing to a nearby school. They also committed to developing a sidewalk connecting housing in one community to a major employment center. And they also were able to pass complete street resolutions in 5 communities and an ordinance in another 7-county region that would prioritize bicycle and pedestrian projects in regional transportation planning. So that was like a really comprehensive effort, but I also want to point out, even small improvements can really make a difference. Last year, my colleagues and I visited the Makah tribe in the Nia Bay Olympic Peninsula in Washington, and they had just put in this crosswalk. And just to talk to community members about how wonderful it was to have some new crosswalks to really ensure that people could feel safer crossing the street. And really the commitment of tribal leaders and transportation planners to begin to look at how to put in more crosswalks so people could do this. Another example that I think we see happening in many smaller communities is looking at how to designate municipal resources for farmers market. That could be helping to designate the land, changing some zoning policies to allow those things to come in. In this case, in Merced County, they wanted to start a farmers market, and there was already a very popular flea market. So the advocates worked with the city leaders to help make sure the permitting would allow for the flea market to include a farmers market. Another strategy we see is joint use of facilities. It's becoming more and more common, particularly in these resource-strapped times, for different entities to look at how to partner together. And so school districts can partner with cities to open up school spaces outside of school hours so that children and their families can use those facilities. And it doesn't always have to be about building new parks, but really looking at where those existing resources are and sharing the liability. And the last example that I know many of you may be involved in is also around farm to school, and particularly in agricultural communities where there's such rich agricultural resources. This strategy not only helps to make sure cute kids like these get more healthy food in their bellies, but also can really help provide some resources for local farmers. So, those are just a couple examples. And now what I'd really like to do, I went through those pretty quickly, is introduce our 2 guests on today's call. We have both Nikki Knoebel and David C. Harrington joining us. And first of all, David, I heard you on the line. Nikki, can we hear you?
I think you can.
Oh, wonderful. Everything is working well now, so we've got you both. First, we have Mayor Nikki Knoebel, who's been a resident of Oak Creek, Colorado for the past 11 years, the last 3 of which she's served as town mayor. She is an active mayor who teaches tennis and ice skating to local residents and has worked with the town board to create their first recreation master plan and identify recreation as a town priority. Nikki has been a member of Live Well Colorado, Northwest Colorado since 2010 and has worked successfully to provide Oak Creek with new opportunities for recreation, including the first town hall, a new pump track park, and a summer activity program for youth. Welcome, Nikki.
Thank you.
We also have on the line David Harrington, who served as the mayor of Bladensburg, Maryland from 1995 to 2002. He's currently the president and CEO of the Prince George's Chamber of Commerce in Prince George's County, Maryland. He is affiliated with Common Health Action and the Institute for Public Health Innovation in D.C., where he has the leadership support team for Kaiser Permanente's Community Health Initiative in the Ports Towns. And he also coordinates the Local Place Matters team for Prince George's County, which is a national initiative of the Joint Center for Political and Economic Studies. David was appointed to the Maryland State Senate in 2008 to fill a vacant seat where he served on the Education, Health, and Environmental Affairs Committee, and he was a member of various health-related subcommittees. I'm so pleased to have you both on this call to really be talking from your personal experience as local leaders. And I think, to start us off, and maybe Mayor Knoebel, you can go first, if you could just give us a brief overview of your community and some of the efforts you have embarked on to improve the health of community residents.
Perfect. We're a town of 873 people. We're about 17 miles south of Steamboat Springs, Colorado. Our town is, people are coal miners, there's ranchers, people work in steamboat, with it being a ski area and a resort town. We've gotten to do a lot of great things in the past 4 years in Oak Creek. We have an amazing ice rink that we've had for about 10 years, and it is roofed, and for a town of 800, we love to have an ice rink, and we use it quite a bit in the winter time. We have it from December to about March because it doesn't have refrigeration, so it melts off. And then a couple years ago, we were able to get a GOCO grant, which is Greater Outdoor Colorado organization, and it's through our lottery in Colorado. And we had an old sewer plant that sat there for 16 years with a wire fence around it, and it was just an eyesore, and we received a grant from GOCO, and we were able to redo the park, and it's now a pump track park, and it's got a half pipe for skateboards, and every Wednesday they're doing yoga down there. I see families just enjoying the green grass of what we were able to change in the community. We also just received another grant for this next summer to redo our Decker Park, which is our main park in town, and add a full-size basketball court and volleyball and frisbee golf, and upgrade. The park goes right by the creek, and upgrade the creek right there and finish the trail system that we have started in town through Live Well Colorado.
Fabulous. Thanks. We're looking forward to hearing a little bit more, Mayor Knoebel, about how you were able to accomplish those things. Before that, Mr. Harrington, can you give us a brief overview of your community and some of the efforts you've embarked on?
Well, thank you very much. And again, if you can't hear me, let me know. And delighted to be on the panel with the mayor. So Prince George's County is located about northeast from, a few miles northeast from Washington, D.C., and from the northern area, and stretches down to parts of Charles County and Calvert County and in Maryland. We have approximately 1 million residents, with about 60 to 65% being African American, roughly about 25% so-called whites, and then we have an increasing population of Latinos that are coming into the county. And so we're a very diverse county. We are one of the largest minority majority populations in the United States. With respect to work, what I was concentrating on, and what was a huge interest of me, was intersecting zoning with community health. And so from a larger frame, then how does policy influences the daily lives of residents, and how do the daily lives of residents influence policy? So in this case, then, how do we use zoning to create better access to parks? How do we use zoning as an innovation tool to improve access to healthier foods by allowing for urban farms to exist, where citizens can actually grow their own food, and as by growing their own foods, they can change their own behaviors. And then looking at zoning and even transportation as a means of providing access then to these venues, as a means of increasing walking, or better yet, increasing mass transportation as a means of reducing then vehicular dependence. And so my work has included, again, how does policy then intersect with health, and then how do you create, through policy and then through zoning, how do you then create equitable communities?
That's great, David. And, I think often in our society what we see is that obesity is blamed on the individual and there isn't recognition of the role that community environments play. Can you talk a little bit about how you and your partners have been able to reframe the issue in your community to be less about individual change, or at least sort of individual change needs to be hand in hand with elevating the need for healthier environments and changes to policy and organizational practice?
So what we've done in Prince George's County is look at data, right? And I think data is the great revealer, right? And so in many ways, then when you see then data and overlapping, with place, then that helps define that it's not about individual predilections, but it's about then changing place. So for us in Prince George's County, what we found is by using data, particularly chronic disease data, what we've seen is that there are certain pockets in our county that happen to be low income, have to be heavily populated by people of color. That tells us that this is not just about individual, standards. And we also see in those areas the lack of parks, the lack of sidewalks, the lack of, and that these places also exist in food deserts, meaning that they have no walkable access to healthy foods. So using data then helps paint the picture, and then that data then influences the policy that then creates the intervention. Yes.
Yep. Great point, David. Nikki, during your introduction, you mentioned a few grants that you received, and it sounds like from our earlier discussion too, you've been incredibly successful in securing grants to implement policies and do planning. Can you talk a little bit about that process and what makes for an attractive grant recipient? How have you really made yourself an attractive grant recipient to different funders?
Yeah, so we have gotten quite a few grants, and Barb Parnell with Live Well Colorado has been a great proponent to help me with these grants. It puts a lot of work into writing a grant, but we really got out into the community, and we really wanted to listen to what the community wanted and not maybe what I wanted or thought the community wanted. We spent many hours down at the parks, out with the kids, surveying. We sent surveys to the schools, through the parents, through everybody, handwritten surveys through the computer, and just really got out and talked to people and found out what they wanted. We also got our public works director, who grew up in Oak Creek, to really get on board of what he saw as a kid and what they really wanted to see now stay in the park, and what they wish they had, and what the people asked for trail systems, and they just wanted more, and they wanted to be active, and they wanted to get out and do this, and that really helped to get people on board by getting out in the community, and then getting out with them after we get the grant and showing people that everybody likes it, getting out there and having events and showing the kids how to use the pump track park and how to ride a BMX bike and how to play frisbee golf. So that was a great, I think, hopefully, word to GoCo that we were really interested, and we got a lot of donations because there's always a match, that we were able to match it, and that really shows them that you're serious. And just because we're a community that is doing a lot, that they see that we do a progress report and they see what we've done, and it's great that they keep looking at our small community for the money.
Absolutely. Well, I hope you continue to be successful in that, and that sounds like it's really you've been able to draw in a lot of resources to be able to make some community improvements.
Yes.
I just wanted to share with everyone who's listening that in a few minutes you'll be having an opportunity to either raise your hand or type in your questions. So definitely, think of what your questions are. I'm going to ask a couple more questions of our panelists before I turn that over to our listeners. But David, we often hear about big cities like New York and Philadelphia and LA and the changes that they're making to promote health, but we rarely hear the stories of smaller and more rural communities. I'd love if you could share, some of the unique characteristics and assets that you feel smaller communities bring to this work. David, did we lose you?
Hello, I'm sorry. Thank you for the question. Can you hear me now?
Yes, we can hear you now.
Okay, sorry about that. What I would say is that you see much more dynamic change in smaller communities than you can see in larger communities. So, for example, it's in smaller communities where people can organize in civic associations, where they can organize in faith-based organizations much more quickly than they can do in sort of larger communities. And the relationships are much more tighter in smaller communities than in larger communities. So, for example, when it comes to organizing around having a park, or organize around what kinds of grocery stores that you want in your community, it's smaller communities that really have the greatest impact in many ways that can influence then their own permitting process, or if they have zoning authorization, can really influence then the identity of their community. So it's in that aspect that you really see some really great place changes in smaller communities and even rural communities.
Mm-hmm. David, you've mentioned a couple times the importance of zoning, and you've mentioned that, to me on the phone that one of the challenges that you'd had was around the ways in which your city didn't have authority over the zoning, that was the role of the county. Can you talk a little bit more about that and how you were able to get around that barrier, and about sort of the relationships you had to build with other jurisdictions to make the changes happen?
So that's a great point. And so from an overall perspective, then the question is, what is the authority that these communities have to make change, and what is the structure? So in Prince George's County, zoning is centralized within the county agencies, and so the small communities or municipalities don't have any authority in zoning or even permitting. And that has caused some disparities, frankly, to exist in some communities over others. So what we've done in many ways, and when I was mayor of Bladensburg, is really then do a couple of things. Number one is educate the community, because let's face it, we're talking at a mid to high level, but when you talk to mom and pop about zoning, they look at you cross-eyed. So you have to translate the policy in a way that they see how it influences their everyday life. So you don't use words like zoning. You say, well, wouldn't you like to have a better grocery store? Or aren't you tired aren't gas prices higher, and aren't you tired of getting into your car? Or don't you wish that you have these wonderful bicycles for your children, but nowhere then for the kids to ride their bicycles? And when you begin to translate it then to them, then you see the kind of activism that they begin to demand of their elected officials, and as that activism that they begin to map out their own futures. And that's how we saw change in Bladensburg, that they began to identify the things that they didn't have, and begin to see that it was through their own activism that they could see change. And so the kind of changes that we saw, we got a grocery store, and even an ethnic grocery store that reflected the community. We got a waterfront park. We got new sidewalks. We got rid of a train that used to literally cross in the middle of the community and create an overpass that allowed them for walkable access to recreation areas. So it's these kinds of areas where you translate the policy to everyday life, and that begins to create some level of activism.
Yep, that makes a lot of sense. Nikki, I'm curious. I'd asked David this question, but I'm curious to hear from you about what you think are the unique strengths that small towns and rural communities bring to this work, and particularly bring to the work that you're doing in your community, particularly.
Well, first and foremost, the people, the community, and when you get people behind you, you can move mountains with people, and that's the biggest thing is just getting, our town hall and our administrators and getting the school really involved in teaching the cooks in the cafeteria how to cook better and how to use product and how to save money with healthier food. And I think that is the biggest thing is our community, and we have a great community.
Wonderful. Well, I'd like to also open it up to everyone on the phone to be able to ask some questions. So feel free to either raise your hand or type some questions into the chat box. Charlotte and Kevin, I'm not sure if I can actually see people raising their hand or people typing in questions, so I'll leave it to you to share what those questions are. And maybe while we wait for people to share a couple of answers, Nikki, are there any examples where you've faced any pushback in trying to move forward with your, different policy and planning initiatives? And if so, how did you handle that situation?
We on different things we've had some pushback, and again, like I had said earlier, that people were like, well, this is just what you want. How do you know it's what the public wants? You play tennis, or you want to resurface the tennis courts. And really getting out and teaching the kids tennis and getting out with the public. Then I had some backup. I had hard numbers to be able to show people what we are going through. And I think when people see me do it, then they are interested in doing it. And we got a ski groomer last year, and we had cross-country skiing all winter long, and it was a pushback on finding the right property. And once we found the right property and people respected their property and people got out and used it and they saw that it really was a community asset, then it changed everybody's mind. So I really think that I try to do the legwork, and I try to be as much involved, and I try to get as much information to show people that this is the way we should be going and with the kids. And then after a couple of years, you see it actually happen, and there's excitement. There's excitement in the community, and it's a good feeling.
Yes, absolutely. Charlotte and Kevin, do we have any questions from anyone on the phone?
We do. We have one. Do you have experience developing access to U.S. forest or BLM land with their managers? If so, can you tell us about it?
Was that for me?
I think it's for either one of you. I'm thinking you might be able to answer it, potentially.
Like as a community, we're close to the national forest that we go out and hike and camp and fish, and we work well with the Forest Service and the DOW. We have people on our town board that works with the Forest Service that is an amazing asset to the town board and to get information, and we work hand in hand with them. But I didn't really understand what the question was other than that.
If I can,
the question is, oh, I'm sorry. I think the question is about formal relationships.
Right.
Okay. And we don't have any formal relationships with them.
I don't know. I can't answer the question about formal relationship with the forestry, but I can say that we have and still have a formal relationship with the Environmental Protection Agency. In Prince George's County, we have one of the dirtiest rivers, the Anacostia River, which stretches not only in Prince George's County but goes to Washington, D.C. So there's need for federal intervention to clean up that river. So I think it's very important to have relationships with federal agencies, not only to begin to send their toolbox and expertise in helping to clean up blight in communities, they also provide technical assistance in a way that then can help the community achieve then some environmental cleanup in this case.
That's a great point. Really great point. I mean, I think, sorry.
Well, you go ahead, Linda.
Well, I was just going to say, I think, it's a great point about how the work at the local level takes the partnerships, across local jurisdictions, but also looking for how to sort of formalize some partnerships with state and federal agencies as well. And I thank you for bringing that example in, David.
No, I think you're welcome, because establishing some memorandums of understanding and those kinds of things really help then enliven the community and bring hope to the community about really positive change.
Yep. Charlotte, are there any other questions from the audience?
There is a question that I think you and I can speak to related to, is there a website you might suggest that provides sample policy language or other resources on built design and zoning? And I think that what we will do is include some of those in our follow-up email and type some in now. The Heal Cities campaign website has some. Heal Nation website has some. The Prevention Institute. Would you like to talk about your ENACT database, Linda?
Sure. I mean, I think there's certainly a plethora of resources, and we have a policy database on our website at preventioninstitute.org called the ENACT Local Policy Database that includes policy language from different jurisdictions across the country and includes some things specifically to zoning. Also Change Lab Solutions, their website has a number of different resources. David, I'm curious, as you were sort of really delving into the issues around zoning, were there any resources that were really helpful to you that you turned to?
Yeah, we used a couple of foundations. For example, the Consumer Health Foundation was a great resource in developing a wellness opportunity zone that we have in Prince George's County that provides for some guidance on granting as well as the changes in the built environment. And so you could Google Wellness Opportunity Zone, and that could give you some features of that. Also, the Joint Center of Political Studies is very helpful when we talk about place and how to change place through policy and zoning. They have some great resources on that as well. And the last one I would point out is Policy Link. They really have some great articles on, again, how to change place and connect it to health.
Great. So, and we can make sure in the follow-up to share some of these links with you, because there are a plethora of resources, and one thing we hear from people is how important it is not to reinvent the wheel, because there's now so much of this great work happening in different places, and to the extent that we can really learn from one another, it really is helpful. So I think I'll just sort of close out by asking each of you one final question. First of all, Nikki, you have accomplished so much to increase opportunities for physical activity. Number one, what's next? And also, what advice would you give to others that are looking at, really increasing physical activity in their communities as well?
One of the biggest things is safe routes to school. We have applied for that grant twice and we have not received it. And our kids get to school across a freeway and railroad tracks, so that's still on our list to get that. And we are right in the middle of updating our Decker Park that I was saying earlier with the new basketball court and trail system, and we're on board with getting a trail system around town and people eating healthier. We have a community garden that people are really active in, and with our summer program that started for the first time this summer that we have tried to get for 4 years, and we had 16 kids a day all summer long. We're now started an after-school program that has started this year, and it started last week, and we've had 6 kids every afternoon, which for us, for the first year to ever do this, it has been amazing. And we are including healthy eating with that. We're teaching the kids how to eat healthy, what an afternoon snack looks like. It's not a bag of chips, it's not a cupcake. It is vegetables and sugar, and so we're really trying to show these kids early on that all these outdoor activities that we have to offer and how to eat healthy. So that is one of our main things right now.
Well, that's great, and I mean, I think you really demonstrate through your work just how comprehensive it is in nature by the various different efforts that are happening, and I really wish you all the best and look forward to hearing more in the years to come. David, to close us out, you know, we're about to talk a little bit about how to really make the case for this type of work and really emphasize to other elected officials, other decision makers and stakeholders in the community and even constituents why this work is important. And if you could just share with us, as you work to create policy, systems, and environmental change, how did you make the case to other members of your city council that this was an important area of focus?
Well, I go back to, and I love Nikki's point earlier, and let me thank you, Linda, for convening this conversation. What a delight it is to share and hear from others about the work that they're doing. But what I would say is, first it's about educating the community, and you cannot change policy with one voice. You change it with many voices, but you're saying a singular message. And so this work went very slowly, and I have to be very honest about that. It wasn't because of some, dynamic, so to speaking, on my part that people thought that they should do this. It really was working the community in a way where they could see that they could make positive change and see some difference in where they live. So that was the first thing. So policy change doesn't happen because you come up with the right words or it makes common sense, and we see that, frankly, in our government today. It happens because that you're able to galvanize a few people that begin to see that change is possible. And so that's what I did, and that's why we got a new park in Bladensburg. That's why we were able to draft a sector plan that's a model in the state. That's why we got biking lanes in Bladensburg. That's why we had healthier businesses come in there, because people said, look, we were tired of seeing, despair in our community, and we wanted to see some difference. And so what I would close with is that the job of an elected official is not just getting reelected again. The job of an elected official is helping to translate things into then everyday life. And when you do that, then you don't have to worry about the next election cycle, and you'll build a base that really is behind you and making sort of the kinds of healthy changes that people really want to see.
Well, that is just a perfect concluding comment as we transition into talking a little bit more about making the case. So I really want to thank you both for your time and your words of wisdom, as well as the commitment that you've shown and you are continuing to show to creating healthier communities. So thank you, David and Nikki.
Thank you.
Thank you very much. And Nikki, I hope to meet you one day. Thank you for your work.
Yes.
So as we go next, we wanted to talk briefly in our last 20 minutes together about making the case. How do we really make the case for this work? And Prevention Institute has really given a lot of thought to messaging about these type of work. And over the last several months, we've also been talking to elected officials working at different jurisdictions and different sized communities. And so what we wanted to do is share with you some of the messages that we've heard from local elected officials working in smaller and rural communities that work, as well as some of the messages that we use. But before we do that, I wanted to just have people chat in, and Charlotte and Kevin, you can share with us. But for those of you who are elected officials or staff, when you're talking to constituents and or other members of your boards, what messages do you use to make the case for healthier communities? And even if you aren't an elected official or city or local staff, we'd love to hear from you, because we all know we're all constantly making the case. So please type in into the chat box what messages you use, and Charlotte and Kevin will share some of the answers. And what I'll actually do is I'm going to keep going, and maybe towards the end, Charlotte, you can share some of the answers for us. In the interest of time, I want to keep us moving. But as we talk about messaging, I really first wanted to talk about the importance of the messaging recipe. And this is actually a recipe that was developed by Berkeley Media Studies Group. And if you aren't familiar with them, I highly recommend that you look on their website. They really think day and night about how do we best frame the need for community change related to health. And as they've described their messaging recipe, it's very important when messaging our efforts around community change is we need to start with the environmental cue. What's the problem in the environment that needs to be addressed? Then the value, why it matters. And, you know, there are many different values. It could be a value around fairness. It could be a value around prevention. You really need to sort of figure out what are some of the values in your community. And I know BMSG has also identified some core values that tend to resonate in communities. And then end with what's the policy change that you want to see happen. And that really will produce the desired frame. So again, please feel free to check out their website for more information as we really rely on them as one of our partners to help educate us on framing and messaging. But as we look at some of the messages that resonate, there were 5 that came up that I want to share with you today. The first is around community prevention saves money, or saves lives and money too. You know, we know that 7 of 10 deaths among Americans each year are caused by preventable chronic diseases such as heart disease, cancer, stroke, and diabetes. And so a message can be that community prevention funding is a smart investment that will pay off by building health, preventing people from getting sick and injured in the first place, and we simply cannot fix our economy without it. This is a really great quote by 2 local city leaders that was produced in a special to roll call. And it says, sorry, I'm trying to minimize my screen so I can see it. It has been said that politics make strange bedfellows, and our unlikely pairing may be Exhibit A, the Republican mayor of Hernando, Mississippi, and the Democratic mayor of Wyandotte County, Kansas. We may be 500 miles apart and have traveled different paths on this journey, but we both share a passion for helping those who live in our areas become healthier and more productive. As in many cities and towns across our nations, our residents fight tooth and nail to make ends meet. But we've both found that investing in health and prevention not only helps our friends and neighbors' quality of life, but it also gives our limited budgets the most bang for their buck. So a really great way we see that prevention saves lives and money being articulated by elected officials. The next is around how community prevention creates healthy and vibrant communities. And, you know, this is a quote from Jack Hess, who's the president of the Chamber of Commerce in a small community in Ohio. And I just love this. He says that the bottom line is this: a healthy community is one in which companies want to locate, businesses want to grow and expand, and the best workforce in the world wants to live. And the third is around local solutions, that, you know, this work is really about local communities developing their own solutions to the problems that they see in their community. Our local community can be a part of the solution by making changes that improve the health of community residents. And our community as a whole can be a healthier place to live and work. The fourth is around partnership and collaboration, and you know that was a big theme for me as I both heard from Nikki and David today, as well as spoke with them prior to this webinar, that they really said that that was a real value in their community. So a message could be, when we work together, public health departments, cities, schools, local businesses, faith leaders, and community-based organizations, we can overcome even the most tenacious problems. We have skilled, creative, and dedicated people who can make our region the best it can be. And the last is really about co-benefits. that, although we may have an interest in health and in seeing healthy lives, our community residents live healthier lives, that may not be the value that some of the members of our boards feel, or our constituents may have other priorities, but that there really is an interrelatedness between health and many issues. People, planet, profit, those are some other community benefits. People are maybe concerned about climate change and want to know how that can be addressed at a local level. Certainly the economy, school board members, really their commitment is to the academic achievement of youth. So where really are the linkages and the opportunities to identify some of the co-benefits and to talk not just about the health impact, but the other impacts that your work will have. So, those are some messages, and I'd really be curious to hear Beth. Beth Kay, I know you wanted to make a few comments, and then if there's some others that, Charlotte, you either want to read, or I'd also love to hear have people raise their hand and we can unmute your line, because I'd love to hear which of these messages resonate, and also what are the ways that you're making the case for this work. So to start us off, Beth, would you share with us? And Beth, feel free to take a couple minutes to answer this question.
Certainly. Thank you very much. I want to say that working in Oregon, my experience has been that there's a pretty good understanding of the problem and of the opportunity. There was a national poll done in 2013 by the Associated Press and the NORC Center for Public Affairs. And the poll found that Americans on the whole, everywhere, have a pretty good understanding of the problem. They understand the link between the food environment and the physical environment and the kind of chronic diseases like type 2 diabetes that are so prevalent. And generally, Americans support expansion of options for healthy eating and active living and wellness at work. Generally, there's pretty good consensus among Americans about that. And for example, Americans really support the idea of more phys ed in the schools. They like the idea of farm-to-school programs that help to boost the local economy and improve nutrition at the school. What Americans on the whole are uncomfortable with, and I'd say this is true for small-town Oregon too, Americans are not comfortable with policies that limit choices. So when we've done some polling in Oregon, what we find is that Oregonians say, we want to eat better, we want to move more, we want to have more energy to do the things we love, whatever that is, if it's hunting or quilting or skiing, anything. And Oregonians also complain about being pressed for time. And I think with this problem set, local elected officials have seen a good opportunity to improve community livability. And communities I've worked with on the campaign talk about the importance of community building, the importance of building the community's capacity to do things like farm to school, to run a farmer's market, the importance of bringing all kinds of partners to the table. I mean, cities are great at bringing in the school district and local business, the faith community, the nonprofit community, but also healthcare. And in this age of healthcare reform, there are more players to bring in. Also, the county and the state. In Oregon, county roads crisscross everywhere, and you can't really solve a local active transit challenge and put in bike paths unless you've got the state or the county at the table, and sometimes the railroads too. So we look a lot at the livability equation and how we can move it forward. Another thing that communities find persuasive is that doing this kind of work helps align the community with the priorities of local and national foundations and also government agencies. If a community has adopted healthy eating and active living policies, it's in a much better position to apply for grants or for its community partners to apply for grants, say to get funding for the coordinator of a local farmer's market. And so understanding how all the pieces fit together and how it helps the community get stronger is what's really been persuasive in Oregon communities. I do want to call out just one other example from Putnam County, Missouri. And the place to look for this is on a website called communitycommons.org, and we'll put that on the memo. But that community, a small community, fewer than 1,000 people, I believe, did an amazing job. Their slogan is Putnam County Good Life, active, healthy, and drug-free. They came up with their own set of priorities and their own 6-point plan for implementing them, and I think they're a great model for smaller towns, smaller communities across the nation. Thank you.
Thank you so much, Beth. I mean, I think there's so much rich thoughts in your comments just about the different ways we can make the case, and I really particularly like some of the emphasis you put on like livability and community building, and the values that people hold for that, and how we can really connect our efforts to that. I'd love to hear from a couple others, so if you'd like to, please raise your hand. In the meantime, I think Charlotte, feel free to read us just a couple of ways that people typed in around how they make the case, and then if you could let us know if anyone's raising their hand, that would be great. Charlotte, are you on mute?
Yeah, one of our colleagues from the city of Belmont here in California, small city, says that healthy community attributes like bike lanes, parks with some active components, encourages residents to be active, and improves their perception of their community. So this idea that how people perceive their community is very important, and these kinds of attributes improves that perception. And then another person commented, and it underscores what you had talked about before, is that they like to emphasize how these are good investments, that evidence shows that efforts to create healthy communities saves money in the long run. We do have a hand raised, and Carly Rachaki, we're going to unmute you if you would like to share with the group.
No, that's okay. No, that was an accident. Sorry.
No worries. Thanks so much, Carly. Well, I think those are really great additional points, Charlotte, that you shared from the text box. And, again, I think even sort of the word investment, I think, if we can really sort of emphasize how prevention is an investment, it's an upfront investment in health, in saving money, and in community livability. So, I really want to thank you all for this really great conversation. And just as we end, a couple of resources I'd like to share. If people are interested a little bit more in how to best make the case for their efforts, I mean, as I mentioned previously, please do check out Berkeley Media Studies Group website. You can also check out our website for our Media Advocacy Toolkit, which provides talking points, information on writing letters to the editor and framing, and has some really great resources in there. So feel free to check that out. And also, I'd really love to invite you to join our Health Reform Rapid Response Network. We follow what's happening in the news around health reform, around community prevention, and when there are big stories on prevention, we provide talking points for how you can respond with op-eds and letters to the editor, and even use those as talking points for a conversation in your community. So please feel free to check those out on our website. And with that, I turn it over to Charlotte to close us out, and thank you all for being on today's call.
We just have a couple of extra slides to show you. One of the things that we want to make sure that all of you consider is the Let's Move Cities, Towns, and Counties. which is a program of the National League of Cities, which is one of our primary partners at the national level. This is the Let's Move Cities, Towns, and Counties website, www.healthycommunities.healthyfuture.org. And it's very easy for your city, town, or county to join Let's Move Cities, Towns, and Counties. And you see in the lower right-hand part of the slide, your elected official will get their picture and on the website, and there will be a profile of the community. So we encourage all of you who are either representing or working in cities or working with elected officials or with city staff to join Let's Move Cities, Towns, and Counties. And again, they're one of our key national partners with the Heal Cities campaigns across the country. And speaking of that, wanted also to bring your attention to the Heal Cities and campaigns that are in Colorado, Oregon, and Maryland and Virginia. And each of these campaigns involves a public health organization, statewide public health organization, and the state municipal league. The state municipal leagues are akin to chambers of commerce, and they have members who are very eager to learn about how health and a health lens can improve livability, can improve the economy, can attract those kinds of residents that everyone is looking for, can improve the lives of residents who are already living there. And so I encourage those of you who are in the states of Colorado, Oregon, Southern Washington, Virginia, and Maryland, and also California to get in touch with your Heal Cities campaigns. And this last slide is contact information for myself and for my colleague Linda Schack at the Prevention Institute. Please contact us with any questions that you might have. We will include this in our follow-up email. And there were earlier questions about websites that have information that could help you answer questions that you may have or lead you to resources. Here are two that you can check out right away. And again, we will send you a few of the others that were mentioned earlier in the webinar. I want to thank all of you for participating. I want to thank you especially for your patience with the technical difficulties. And I got a message from someone saying that the content, particularly Linda's comments and the comments from our elected officials, was very useful. So thank you very much, and have a wonderful afternoon.